What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. Question from the tribe today. Had a new nurse ask for tips on how to manage more than 5 patients. My tips and suggestions can be applied to any number of patient assignments. So you got more than one patient, my tips can benefit you. I thought of 6 things that could help you manage your time more appropriately. Number 1, prioritize. Duh. You need to prioritize. And what I mean by prioritize is what is life and death? What is going to kill your patient if you don't take care of it? And what can you shelf till later in the morning, later in the afternoon? We all know that getting cleaned up and bed baths are a priority for the patient, but it's not a what's more of a priority? Giving them a bed bath or making sure they get their 9 a.m. cardiac meds? I really hope you chose the cardiac meds over the bath. Not saying that the bath's not important, but prioritize what absolutely needs to be done down to what could possibly be even left until the next shift. Number 2. Goes right along with prioritizing is what can you delegate? Look at all the things you got going on today and figure out what you can delegate to other unlicensed professionals. What can you delegate to the secretary or the unit clerk? What could you delegate to coworkers that could lessen your burden? I'm not saying turf it to somebody and give somebody else your responsibility. I'm simply saying when to know to ask for help. Number 3, know yourself. You got to know what your strengths and what your weaknesses are. If you're just starting this job, then yeah, you're going to have to learn. But you need to know what you are efficient at and what is going to take a lot of time for you to complete. Are you efficient at IVs? Are you efficient at placing, an NG? Are you efficient at giving a bed bath? Are you efficient at giving medications, or do you take extra time? There's a million things that I could go through, but you need to think about what your capabilities are. Number 4, start small. Pick some tasks that you can get done immediately within the first 5, 10, 15, 30 minutes of your shift. Get those things out of the way. Boom. Then you feel a sense of accomplishment, and then you can move on to the next task. Take on a bigger task and then a bigger task. Do not take on the largest task possible first thing in the morning because it will drag you down. Number 5, and this is a very hard pill to swallow. You need to accept before you start your shift, you need to accept that whatever plan you have in store, whatever vision you have for your shift is probably going to fail. Something's going to come up, something's going to change, the condition of your patient's going to change, you're going to have an admission or a discharge, you're going to have a call off, there's going to be a bagillion zillion things that are going to happen during the course of your shift that are going to put you behind in some way, shape, or form. Accept it. Guess what? Welcome to nursing. You are very rarely going to be in front of the 8 ball. You are going to be constantly behind the 8 ball. In fact, the 8 ball is going to run you over, back up, run you over a second time, might even circle around and bang you in the head a few times. The 8 ball is not your friend. Welcome to nursing. Get used to it. It's all about being an efficient fireman, fireperson, firewoman. Putting out fires. That's your job. Putting out one fire at a time. You are not a miracle worker. You are not a superhero, even though you'd like to be. Manage what's in front of you and then move on to the next. And number 6, and I left the best for last. At the end of the day, regardless of how overwhelmed you feel, at the end of the day, if you have this particular thought in your mind, you will never lose. The patient comes first. I don't give a crap about having to give your meds within that hour time frame. I don't give a crap about CT scan or fluoro calling you or the GI lab calling you because you're late giving their prep. I don't give a crap. You can tell them all to shove it. Your patient is the priority. The patient comes first. Take care of your patient. Everything else will fall into place. Think about your patient first every time you do something. Charting is always in the back of our minds because we do so much of it, and the old adage of if it isn't charted, it isn't done constantly just burns a hole in your brain. Charting is not going anywhere. You will obviously do charting at some point during your shift. Take care of the patient. Take care of the patient so that you know at the end of your shift you've done everything you were supposed to do, which is take care of the patient. 6 really simple but effective tips to help you manage the overwhelming assignments that you have. Always would love to hear any suggestions from the new or seasoned nurses out there. Any tips or tricks that have helped you manage the overwhelming odds of multiple patient assignments. Leave your comment down below. You know your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.